Hello and welcome to another podcast from Dell Technology. Today we're fortunate enough to be joined by Tara Donnelly. Hello, Tara.
Hello, and thank you very much for having me on the show.
Great pleasure to see you. Tara, I wouldn't mind if you started telling the audience a little bit about your professional background, please.
Of course, I'd be delighted. I began working in the NHS a long time ago, 35 years ago. I was 18 and I worked as a ward housekeeper in a hospital in Guildford in my year off, just saving up to go travelling. But I clearly got the bug because then after uni, I started in a very junior management role in a different hospital and essentially spent the next 30 years or so working my way up, having increasingly large chunks of hospitals to run. I was director of operations at the Whittington, then chief exec at the West Middlesex Hospital, was in a number of board roles at UCLH, and then I got my second chief exec role at the Health Innovation Network across South London. And then from there, I took the job as chief digital officer for the NHS, was there during the pandemic, which was fascinating, and we helped set up the first tech-enabled virtual ward. And I was there for 4 years before taking the step last March to work independently.
Okay, could you tell the audience a little bit about the work you did during COVID?
Yes, I'd be delighted. So one of the first things that happened when the pandemic kind of hit the UK, which was the lockdown happened in March 2020, was that I was approached by a doctor who was running one of the biggest virtual wards in the country, but with no technology at all, pen and paper, an Excel spreadsheet, and an awful lot of phone calls keeping people at home. And they were just beginning to see the first COVID patients. And he asked, was there any technology that could help them? And at the same time, people were being incredibly generous with their offers. We were getting a kind of fire hose of offers from technology innovators, sometimes in completely different spaces like banking, because people wanted to help. And we were able to partner immediately. That request was made with a pro bono offer from a remote monitoring company. And 4 very hectic weeks later, that first service was live to patients and was then expanded as the model of care across the NHS. So it was a great time in terms of things happening really rapidly because of that urgency and the speed of decision making, that actually things that people had looked at for a long time as possible just offered a solution that could really help.
Okay, and you're still a member board of the trustees of independent directors, aren't you?
Yes, I am. I'm the senior independent director at the Nuffield Trust, which is a leading think tank, an analytics centre, a role I really enjoy, I have to say.
Okay, fantastic. I'd like to start with talking about your new experience and your new entrepreneurial, the new company you started.
Yeah, so I have a particular passion for advancing digital home care. I kind of joke that after 30 years, mainly in hospitals, I've learned the error of my ways, and actually it's all about home. And we have this incredible sweet spot, I think. We've got public appetite that's so strong for these technologies. Some recent research done over the summer by the Health Foundation showing older people are even more keen than other age groups to stay at home well with technology. So I think it's really good for patients and popular. It's really great to be less dependent on a hospital service. I think for long-term conditions in particular, we've become far too tolerant of hospital as the answer. Nobody really wants to be there. And the joy is that technology's improved, it's become cheaper, and it feels to me like a great moment in time to really see how far this could go. So that's the work I most enjoy doing. We've got a group of 6 of us working together. Most of our clients being in the NHS or arm's length bodies such as NICE, and a small number of private sector clients, of whom the most significant is Doccla, the virtual ward company. So that's really. And the other thing I think about why I feel that digital home care is so important is it's responding to the 2 really great challenges that face the NHS at the moment, and indeed all developed healthcare systems, which is capacity on one side and workforce on the other. So this gives additional capacity that's in people's homes, and it makes the skills of the clinical workforce go further. They can safely look after more patients. So that's what we now do. We work with selected clients. We help to drive up scale. We're definitely at the implementation end. It's not a kind of strategy consultant. We don't do wonderful slide packs. We do do the odd slide back, but we actually roll our sleeves up and get involved with patient uptake and the kind of transformational change part of working with clinical staff to bring in completely different care pathways than they've used historically. And across the team of 6 of us, we've got a real range of expertise. We've got clinical people, operational folk like myself, people with expert improvement and digital skills. So it's it's boutique, but it's proving great fun, and we're getting an awful lot done. So yes, I've loved my time in the NHS. I wouldn't change anything about that at all. But it is quite liberating to work for oneself too.
Absolutely. So would you be in a position to talk to us about any of the case studies you've done? Something like West London Cancer Alliance, something like that?
Yes, no, happily. Yeah. So we are quite new, been going for, under a year, as you say, but in that time we have worked with some fantastic clients, one of whom is the Royal Marsden Cancer Alliance, which is the cancer alliance that covers both Northwest and Southwest London. So it's really big. And what we've been doing there is that the cancer alliances now have quite significant digital budgets. And so we've been helping provide support and bandwidth to their really interesting program about helping people living with cancer use technology to good effect. And one of my team has been in there for the whole of the period. Pip Hodgson, who used to work on the NHS app, so very skilled and a nurse by background. And that's been a really, I think, a very, very satisfying arrangement from all concerned, because we've been able to bring expertise and the team there can then focus on the very busy day job, not the additional aspects. So we've done things like run their Innovation Fund program, where all the trusts have got funding for different bids and making sure that's all happening. But we've also worked with some other great people, Frimley Health and Care, who are doing some leading work in the digital home care space, particularly trying to focus on people whose need is greatest. I think they're using population health data fantastically to prioritise who they use. We've done some great work at University College Hospitals, a digital review for them. And then more recently with NICE, the National Institute for Clinical Excellence, on launching their virtual ward offering, which was really interesting in a kind of slightly different way. And then Doccla, we've been helping provide support to change on the ground. They're busy winning, an awful lot of new work, but the change that has to happen is for people to really rethink the way they've been working in terms of medicine and nursing for often 20 years, to make the most of it, to increase patient uptake, which we've been able to do really successfully. And we're currently opening a new health hub for people with COPD, something that's been a passion of mine for a while. So that's really satisfying, and that's working with the clinical team down in Bristol.
Oh, I didn't realise that. Okay, so could you tell me a little bit more about the COPD work you're doing in Bristol, please?
Yeah, sure. So COPD, so it's the term that's used for some pretty common and progressive lung conditions like emphysema. So they get worse over time. But the good news is that there are lots of things that people with COPD can do to keep well. But that's quite a lot for people to manage on their own. So we do see that some people are in hospital perhaps 8 times a year, being brought by ambulance, and often quite a scary experience because it can often be due to breathlessness. And COPD is also very much a disease of deprivation. It's not a burden that's shared equally across the population. So we were keen, and this also was what the team at Bristol were feeling, to try and put extra support around those people who needed it most, to use the data, a bit like Frimley has done, to look at who we think is at risk of coming into hospital this winter with their COPD, and giving them extra support. And what that extra support looks like is some remote monitoring technology. So they'll be sharing their oxygen readings and questionnaires about how they're feeling, and also health coaching remotely. So they develop a winter action plan of the things that they want to do to try and keep themselves out of hospital, and the coach helps work with them. So it might be about increasing exercise, it might be about stopping smoking, it might be making sure that they're up to date with all their vaccinations to reduce the possibility of admission. And this is builds on a really mature hospital at home model that's there with Serona in Bristol and working with the two acute trusts. So it feels quite a natural progression, but we are really excited about it because we know some of the best places in the country have hugely reduced emergency admissions for people living with COPD by 20, 30 and even 40%. So we'd love to do something similar. And it's a piece of work we're really fascinated to be getting going with those partners.
Okay, so Tara, can you tell me something about some of the work that's going on in Europe right
Yes, there's actually some really interesting work happening in France at the moment. So, France has had a program for over a decade of supporting remote monitoring for 5 specific conditions, and that's actually got quite large. It looks as though about 150,000 people are supported. COPD would be one of the conditions, but also things like heart failure. But they're taking a really big step forward beyond that, which is that they set up last year a new scheme where if a doctor believes that somebody would benefit from remote monitoring, so they need some element of follow-up, that is reimbursable through the health insurance system in France. It's a really major step. Now, we know that the products that are being assessed probably going to take about a year, and this began on the 1st of July last year. So it'll be a little while before we see the impact, but I'm really interested in that as an approach, and I would love to see the UK being as bold as the French are here, and making it a real mainstream part of care with the right incentives and the right tariffs so that it really changes how medicine's being delivered. And of course, France and the UK have almost exactly the same population size. It's almost identical, even though France is so much bigger as a country. So there's lots of parallels. And I think the UK was really bold around COVID, and it was made a terrific commitment to virtual wards. That's amazing. I would love that same commitment to be made to long-term conditions next. I think that would be brilliant. And I think France is such an interesting example of where they are doing just that. I'm very fond of the NHS because that's where my background is. But I do think that all our health systems have got more in common than difference.
now? They have, absolutely.
And that in terms of kind of really grasping the digital agenda, Germany has been excellent, and France has made this real commitment. Belgium's doing really rather well. So I think let's all learn from each other. So I am interested also in how things progress across Europe. Denmark has been one of the longest standing countries to commit to remote monitoring with terrific results. They were doing COPD work like I'm talking about 10 years ago. And that is their model. So I think Australia also did some wonderful stuff in the pandemic, including using chatbots. So there is a kind of community of people who, it's quite mission driven, I have to say, digital home care. So it's great, and people are very generous about sharing. But yes, I do think there are great opportunities. Italy has just recently gone to tender for a countrywide. So we are seeing this as a development everywhere. And historically, it's been more advanced in the US around insurers recognizing that this is how you keep costs down in many ways, that you keep people well at home, but less so in Europe. So I think that is now changing.
Okay, fantastic. All right. I think that with regards to the work you're doing in the United Kingdom, I would like to talk about what it is that if I'm an ICS director, I'm a trust director, and I'd like to get more involved in digital health. How would you come along and work with me?
So that would be an amazing opportunity. Now, it's because we now have virtual wards everywhere, I would say every ICS has at least that knowledge of the potential in its patch. But I think lots of people just think virtual wards and that's it. So just to be really clear, the definition of somebody who can be cared for in a virtual ward is they would have otherwise been in a hospital bed. And that's important. And the growth there has been really marked. So more than 8,000 people would have woken up this morning in the NHS in England in their own bed getting hospital level monitoring. So it's not well known. It's not kind of celebrated enough. It's a quiet victory that's happening. But it's also not all of it, because the people like I was describing with COPD would not necessarily be in a hospital that day, but we might be seeing signs that are saying, well, they're going to be in a hospital next week if we don't manage to contain the situation. So I think the virtual ward work is fantastic and worthy of great celebration, but it's not all of the story. I would love to see, and for an ICS chief exec who's thinking about their patch, the reason this really matters is that our hospital occupancy is at an unsustainable level across the NHS. And that is the root cause, I think, of lots of other problems around waiting. We just don't have the redundancy in the system to mean that we can perform all the time. And that means that every winter, the surgical programme reduces markedly. So even though our waiting lists are very high, the amount of surgery done in a January and a February and March is nothing like the amount of surgery done in a normal month like September. So what you can gain by setting up a really comprehensive remote monitoring program, and I mean to thousands of patients. So Airedale currently looks after more than 4,000 people with COPD. Once you get into that level, and you see that it's one of the most common reasons for hospital admission, and almost always by ambulance, 96% of the time by ambulance, you can see that this is causing a real issue for ambulance services, for A&E departments, and for the people who really don't want to go to hospital in the first place. So taking a bold step means that you start using your hospital resources much better. You could predict the levels of inpatient activity. You can have occupancy at a level that's not creating burnout and distress for people, or having, clinical staff spending their time looking for beds rather than looking after patients. And you can also start impacting waiting lists by having a predictable elective program that can carry on throughout the year. But you only get that with scale. If you do it, if you're helping 50 patients with COPD and heart failure, you're not going to see that benefit. And I think, although it has been, the funding that associated virtual wards has been absolutely instrumental in the huge success of it, I think we're now at the point where people have to start thinking about using different funding to change the models to enable that sort of level of change.
Okay, all right. You've got a number of interesting people on board. Could you tell us something about those people?
Absolutely delighted to. So Jenny Thomas, I'll start there because she was the first to join. Jenny Thomas has had a fantastic career. She's been in ops management in trusts like Guy's and St Thomas's. And then for several years, I think maybe 5 or 6 years, she ran Digital Health London's accelerator. So probably she has vetted more software companies in health than we've all had hot dinners. But that was a program, a 1-year program that was incredibly competitive to get onto, where she and her team at the Health Innovation Network and the other London AHSNs would provide support on NHS navigation, help companies refine their products, find sites to test it on. So that gave her an incredibly hands-on experience of working across digital health. And she's now, she's actually working full-time currently for Doccla, helping set up the Health Hub among other activities, program now called Living Well with COPD. So that's Jenny in a nutshell. I also have Breed O'Brien. Breed is a nurse by background and has been working in the technology space for many years. She was also my deputy at NHS England, so was closely involved in that programme around virtual wards expansion and setting up the COVID response. So terrific blend of skills and a kind of professional improvement expert. She's IHI qualified. I have Pip Hodgson, who is also a nurse, who I mentioned is currently leading the work at Royal Marsden Partners, so a consummate programme manager with that clinical expertise and the digital knowledge as well, because of running the app and NHS.uk for many years. Natasha Phillips is where I was going to go next. Natasha Phillips was the first ever Chief Nursing Information Officer for the NHS in England. She's obviously also got a nursing background, and we've done some terrific work together, including she's recently been doing some work to look at the kind of long-term management remote monitoring areas Yeah, so she's a terrific addition. And last but by no means least, Leslie Soden, who has again had a really interesting kind of operational career, but was also Director of Improvement and Innovation prior at the Health Innovation Network, an amazing kind of bid writer. We worked together on the UCLH project. So it's a really, they're all senior people who are very autonomous and able to give something quite different in terms of their perspective. And I have to say, are an absolute delight to be working on the team.
I'm very impressed with the work you've been doing at West Cancer Alliance. Personally, I've got a number of friends who talk highly about you, and I can assure that everybody in this audience that the work you do is very genuine and I think it's outstanding. So I'd just like to thank you very much.
Oh, that's so kind of you, Stephen. Thank you.
No, it's true. I think you've done an amazing job in the NHS, and you've made a big difference to people's lives. So I'd like to thank you very much for joining me today. Very kind of you. And I hope to be talking to you again in 6 months' time, when I know that you'll be doing a number of other projects across the National Health Service and possibly even in Europe. So I wish you all the very best.
Thank you so much.
We can do to help you. Thank you very much.
Thank you, Stephen.